Welcome to the Analytics and Outcomes podcast, brought to you by NextHealth Technologies. Our series explores innovative healthcare companies and their breakthrough insights. Subscribe today by visiting nexthealthtechnologies.com/podcast.
Hello and welcome to episode 3 of the Analytics and Outcomes podcast, brought to you by NextHealth Technologies. My name is Eric Grossman, and I am the CEO of NextHealth. Today I'm speaking with Sue Birch. Sue is the Executive Director of the Colorado Department of Healthcare Policy and Financing, otherwise known as HCPF. HCPF has a budget of roughly $9 billion and is the single state agency administering Colorado Medicaid and the Child Health Plan Plus program. Today, Sue and I will be speaking about Medicaid expansion in general, and in particular about innovation. We'll also be speaking about how Colorado is using data and analytics to drive outcomes, the lessons Sue has learned, and her vision for the future. Sue, welcome to the program. We're so pleased to have you as our guest.
Thank you, Eric.
So tell us a little bit how you got into this $9 billion opportunity. What's your background?
Well, I'm very lucky that Governor Hickenlooper asked me to join his cabinet as a nurse serving with this administration. I had a pretty extensive background in home and community-based and public health services, and I was very fortunate to have a huge landmass of services going on in northwest Colorado. Sparse population, so you could get a lot done, you could do a lot of innovative work, and we really designed some pretty amazing programs for the future of healthcare. So from that, Governor Hickenlooper asked me to come down and work on his team, and it's been fabulous. We have done a lot of work to try to move in towards a good government legacy, and I'm proud to say Colorado has really continued to ascend the ranks in overall health status for our state.
Well, great. With over 1 million recipients, it's quite the responsibility. Good segue into Medicaid expansion. Can you tell us a little bit about how that's unfolded over the past few years?
Yeah, Eric, I'm really proud that Colorado really set out to overhaul healthcare reform even before President Obama signed into law the Affordable Care Act. So back in 2010, the department really began to bring up new populations, and they expanded first the income eligibility for the Child Health Plan Plus. They kind of warmed up on the commercial side. In April of 2012, we launched a program aimed at adults without dependent children. And those were really poor adults. These were folks that were living on less than $90 a month. And we brought them in kind of on a very staged approach where we brought in only so many. We really limited that initially. And again, we kind of warmed up the systems and warmed up the clientele to getting onto Medicaid. In July 2012, we began the Medicaid buy-in program for children with disabilities. And again, all of these incremental expansions really helped us move forward with bringing on new populations and staging and getting ready for the big expansion, which began in January 2014. That is when Colorado officially opened up the coverage for single adults for our state. And by the end of February, we just had enormous success with getting literally hundreds of thousands of people enrolled and on service. Now, we're really pleased to announce that Colorado has achieved nearly 94-95% coverage. What took our friends in Massachusetts about 5 years to do, we did in just under 2 years. And it's been a lot of hard work, and it has definitely been achieved through all the partners and stakeholders here in Colorado, but it has really driven enormous economic success for our state. Just last week, the Denver Post announced a new study that was undertaken that showed the economic impact. Pleased to tell you that we created over 31,000 jobs in the health and human services sector. We saved $103 million on our state's general fund. And it has brought in an economic stimulus to the state of about $3.4 billion. Huge success for our state.
That's great achievement. I'm proud to be in that state with that kind of innovation and growth. One of the things that I read about, and maybe you can talk a little bit about, is your Accountable Care Collaborative in Colorado and the effect and impact that's had?
Yeah, so Eric, you're talking about the success of our Accountable Care Collaborative, and that's a framework that we launched in 2011, and our goal was not to simply deliver healthcare, but to really improve the health outcomes of our Medicaid members, to really get at improving their health. But we had to do all of that while keeping an eye on the cost of this program. And I'm really pleased to tell you that over the last 4 years, the program has saved about $285 million gross and about $77 million net, and that's after accounting for the provider incentives. And this framework of the Accountable Care Collaborative is done in 3 ways. It's done through the regional care collaborating organizations, it's done through our investment in primary care medical homes, and through unprecedented data analytics. So we have really invested enormously into these 3 arenas, and they have all pointed at improving things like personal health behaviors, access to medical care, good provider-member communications, a more connected and navigable health system, and access to resources to meet kind of the basic human needs. Now, of our nearly 1.3 million Medicaid clients, just over 1 million are enrolled in the ACC. And of those million in the ACC, 75% of them are attributed to a medical home. And so their care is more tightly coordinated. And it's through these platforms that we're able to really keep moving forward with innovations and really move towards greater integration.
Well, that's great. I think that the commercial market can take some chapters out of your playbook. You know, in a government-regulated environment, you know, how are you getting that kind of innovation through the right channels?
Well, again, I'm really thrilled that there's been enormous partnership and collaboration throughout Colorado, and we had a framework that really was based on an approach that was very broad. We said health doesn't just include health care, but it's got to include prevention and wellness and those social factors. Things like having a good job and a healthy place to live, really important. Secondly, we said, let's be opportunistic. Colorado really leaned in and said, hey, let's make this Affordable Care Act work for us, and let's accelerate on the changes that we were making, but let's really drive towards some of these innovations. Third, we said, let's do it in this integrated way. And by this, I mean that people don't just need really good individual health care, and we really we wanted our clients to have integrated physical and behavioral health systems. And we wanted our clients to be much more cooperative and engaged and empowered to really take stock of their own health and well-being or to manage their chronicity. And then lastly, the 4th part of our framework was that we were just so committed towards economical and a focus on value, where we really wanted to align with some of the principles of private insurance programs, but really looking at how do we move more vigorously into payment reform, how do we tie compensation and incentives to better outcomes, and how do we just be certain that we're using our government resources very efficiently to really drive the best deal for taxpayers. So these 4 traits really helped us align with what the governor charged us to do, which was get Colorado to be the healthiest state in the nation. I will tell you, Eric, that we are one of only 4 states in the country that moved towards expanded Medicaid. We took on operating a state-based marketplace, the exchange. We created a co-op. We won't talk too much about that because it was launched, it was successful, and then it died, unfortunately. And then last and most kind of exciting frontier that we've been moving into is we won the 4th largest SIM grant, the State Innovation Model Grant, which allowed us to move much more vigorously towards integrated physical and behavioral health care. And we are really partnered with CMS and CMMI, pushing the edge with them on things like the Duals program, pushing the edge with investments in information technology systems. We're one of the leading states in the country to be bringing up better data mining systems. And so our debut here in November with our business intelligence data mining system is going to be really exciting work that will really propel us forward.
Well, great. Those are with $280 million in savings. It's quite an achievement. It looks like you've been moving a lot of big rocks. Is there anything else you can share with us around your relationship with CMS? It sounds like that you've got a lot in the oven there.
We do. A lot of this work, though, really aligns with Secretary Burwell's work around the payment taxonomy and really maturing payment towards value-based design. We also aligned very closely with a lot of our quality partners around making certain that our adult Medicaid quality metrics lined up. We had some very exciting work that was sponsored by a foundation around reproductive health and the use of long-acting reversible contraceptions. And then CMS and SAMHSA, there were initiatives around enabling certified community behavioral health centers to improve services for their clients in the community mental health system. And all of these innovations and these opportunities really stacked up so that Coloradans were able to make better health choices and to kind of reduce some of the challenges or obstacles that they often in the past have run into. So our federal partners have been willing to come along with some of our innovations, and they have been quite generous with funding through many of their match opportunities, our progress.
Right, so it appears as though the tail's wagging the dog or the dog's wagging the tail. Not exactly sure which part of the dog you are. So tell us a little bit about the lessons that you've learned in this recent journey.
So Eric, I think it's really important for states to understand that health is far bigger than healthcare and that we have to have cross-sector approaches. We work extensively with our Human Services Department. We work extensively with the public health folks. We also have leaned into our Department of Education partners. And most recently, we're starting to look at how we work with the Department of Labor. We think having a job and keeping productive and busy is really a great way to avoid some deep depression issues that some of our folks can run into. So I do think this cross-sector strategy of how government really works together differently is really important. I also think that in this day and age that learning networks and the ability to really communicate out the learnings and work collaboratively and the kind of governance and the flow of kind of this knowledge sharing is really critical. And we've really had to work through our communications teams really extensively about how we harness all of this change energy and keep it less chaotic, if you will. I think at times it can be pretty overwhelming for our partners, and so we've really been very intentional about trying to manage the change. There are many that would say we thrive on chaos and have a little too much going, but we think it's really important in order to get at the triple aim and in order to help people with kind of their life, what we call the success sequence. We think it's really important that this work kind of play out together in the right timing. So I do think the cross-sector approach is really critical, and that's been a big learning. The communications with our partners has been a big learning. I think you couldn't do any of this work if you had a rigid mindset. I think it's critically important to be innovative and adaptable and to be fearless. I think you have to have a fair amount of courage to try some things and also know that you're going to fail. We're just glad that some of our failures have been small scale, small demos, but I do think when you do hit on something that works, you have to look at how you replicate and or how you get that to very quick scalability.
Agreed. Sounds like within chaos, though, there's been lots of opportunity for HCPF.
That's true, and I think we've been artful about trying to balance kind of that long view perspective, but also really kind of having a short-term focused get things done. And so I think in that space of always kind of watching out for what's coming, but also then really delivering on what's right at hand has been one of our strengths. I do also think that the investments that we've been making in modernizing things like our eligibility and enrollment system and in modernizing some of the centralized functions that our state government has doubled down on, things like prior authorization and utilization management, fraud, waste, and detection. All of those things are really important for states to look at, and we're our belief in kind of reducing the manual load, the manual work for internal and external staff will be even more broadly adapted as we launch these new systems in November this year. And we'll have a lot less manual intervention, and we'll be able to use our data mining at a much faster scale, and we'll be able to really just stay much more current instead of analyzing really years old data. I think we'll have much more access to information.
So speaking about information and data, it's hard to have a conversation without the word big data. We're not exactly quite sure if that's in a lake or not, or what, or if it's big or small or meta. Tell us about the role that data is playing for HCPF in the past and perhaps going forward.
So this is one of our newest frontiers, data mining, prescriptive and predictive data analytics. And I am really proud again of our team that we've leaned in and been open to look at kind of these new tools that are at hand. You know, some of the technology that we inherited really stems back to 1970. And I'm really pleased again to tell you that come November, we've really eliminated a lot of those old green screen tools that really delivered great return on investment for decades-old tools. But it's time that we put in these new, more modern systems, and they'll help us identify health trends in a much more efficient manner, much more quickly. They'll help us get to our populations. So if we have a first-time low-income mom who's going homeless, we'll be able to find her, get her into the programs that she needs, get her to the primary care health home so that we can get on that care before, we have untoward health outcomes. We want to really enhance kind of those maternal child health outcomes of some of our clients. And by really staying on top of this data and using it in a different way, I think we'll be much more able to be interoperable with other departments and other technologies that are becoming more readily available.
That's great. Has the data shed any light on any problems that you didn't know about before?
Well,
or has it sort of confirmed what you already knew?
I think I have to say, as a nurse, it confirmed a lot of my intuitive feelings. But yes, I think things like reducing emergency room use, reducing high-cost imaging, reducing hospital readmissions, some of the really expensive items that hit us in the public sector, we've learned to get on top of and work with our systems in the primary care medical homes to manage those in a much better way. Obviously, we're still exploring. I think we're trying to figure out what are the most low-cost nudges that we can put into place to really help our clients make the best choices and go to the best locations. And so we're still exploring this whole area of nudging and cueing our clients for the best evidence-based programs that are out there.
So with all this newfound big data, I'm sure you're coming up with opportunities, but what are some of the challenges you face with this new system and capability?
Well, there's no shortage of good communications work to keep everybody involved and everybody up to speed, because I think there are many people that struggle sometimes with coming along with our healthcare transformations. So I really think having a team of communications experts that really help you, I think also having some outside minds with this exploring the data systems, very important, because this is a new area for many of us. And I think that you really have to have thick skin and a lot of persistence to keep the momentum going, because I think once you are in the middle of change, you've got to keep really moving people forward and don't go easy on letting anybody turn back. I think you just have to be pretty fearless about keep pushing forward into a new direction.
Would you say around data that you're sort of using it to operate the business, drive the market? So where are you in terms of the maturity of your data investment?
Well, I think clearly in 2011, when we began with the Accountable Care Collaborative, we launched with the State Data Accountability Contractor. I think we're in the second iteration now of data, and I think our new investments into business intelligence data mining are really going to serve up some significant returns for us. We will have a better look at the whole person, and we'll be able to move more quickly to make certain that we don't have greater financial losses as some of our 1.3 million clients go through the system. So I think that we'll be able to deliver on the triple aim, right services, right time at the right price. So we do feel like we've made good progress in data maturation, but I do believe we'll look back in 10 years and say, wow, it didn't go fast enough. So we look forward to how it continues to evolve and mature.
Well, you sound pretty advanced in a lot of the terms you're using, from business intelligence to predictive to prescriptive. So it sounds like you're on the right track. So as we sort of round home here on the podcast, last question, Sue, for you is, what advice do you have for other Medicaid or managed Medicaid executives who are on the same journey with the same kind of growth in Medicaid?
Well, again, Eric, I'll go back to where I began. I do think people need to keep in mind that health is much broader, that they need to be opportunistic and proactive, and they need to be very forward-thinking. I think they definitely need to look at how they manage integrated teams. And I think, lastly, in our country, we have to get very real about this focus on value and being much more economical with the limited resources that we have.
Well, thank you. That was an excellent interview, and we appreciate the time and look forward to watching more news articles in the Denver Post about HCPF and especially your new name that's coming up soon. So thanks again for the interview.
Great. Thank you.
Thank you for listening to Analytics and Outcomes. If you like what you heard, consider subscribing by visiting nexthealthtechnologies.com/podcast, and be sure to visit our archive section for previous episodes. This has been a NextHealth Technologies production.